Hey, I'm Dr. Josh, and I'm here with Lauren, and we are excited to roll out our services that are helping people recover from concussions and post-concussion syndrome. And very hot topic. There's not a lot of services out there that can provide the needs of what an athlete or somebody dealing with a concussion or post-concussion syndrome needs, so we're happy to bridge the gap with that. And both from a concussion standpoint and a post-concussion standpoint, there are different needs because they are two different types of conditions. So we're going to go through that. Mostly we're going to focus on, because what we deal with are people that are in the prolonged situations with concussion and not fresh out of the gate with concussion, because there is acute management and there's the waiting period and you've got to let these things settle in. But ultimately what we're looking for is to help those that are suffering longer term with this and getting them the right types of solutions. So the first thing that we want to explain here today, and I'm going to turn this over to Lauren because she is the practitioner in the concussions, has been well trained in utilizing the treatments that we have for our athletes and the people that are dealing with these post-concussion like syndromes. So the first thing that we would talk about is, how do you recognize the difference maybe between a concussion, right, and some of those symptoms that are post-concussion related? So how do we understand where we're at in the symptoms of concussion and mild traumatic brain injuries?
Right, sure. So usually when you initially sustain a concussion, there's going to be some type of confusion. You'll probably have a headache, especially if it was a direct impact to the head. There might be some behavior problems, some psychological problems that go along with that. However, to distinguish between the two of concussion and post-concussion, concussion symptoms, the main symptoms like the headaches, the dizziness, the behavior problems, usually those will clean up within a 7 to 14 day period. If 3 or more of those symptoms occur for 4 weeks or more, we know we are kind of in that post-concussion stage.
Good. Great. So that post-concussion stage can happen over a period of time. Mm-hmm. It's not right away. And when we get into that, or I should say an athlete gets into that post-concussion stage, what are some of the triggers? What are some of the, I guess, cofactors, causations, or comorbidities that these athletes might be dealing with that can stimulate, that can trigger this prolonged concussion response?
Sure, yeah. So one of them is just returning too early to return. So like I had mentioned before, typical concussion symptoms will probably diminish between 7 and 14 days. So at that point, if that athlete is not under supervision of a healthcare provider and they decide to go run around or go back to their sport without being cleared by a healthcare provider, they could be returning too early. Even though they feel fine, there's probably still some other things stirring up. So when they do go back to playing, they notice that these symptoms start coming back. Okay. Another main one is medication. So especially overuse of NSAIDs, so non-steroidal anti-inflammatories.
So like your aspirin, your ibuprofen.
Right.
Okay.
Yeah. So and it's not even using a significant amount of ibuprofen to dull the symptoms of the concussion, but even using it before you even got your concussion. So relying on those things for minor aches and pains can be a trigger to some of these post-concussion syndromes or symptoms. Right. Another big one is nutrition, especially in today's on the go for many athletes.
Lifestyle,
they're going from one club sport to another. They've got so many different things going on. So when you get a concussion, you automatically light up the inflammatory responses, it's a natural thing, yeah. Right? The body needs some inflammation to heal itself. It's when we get into that prolonged inflammation where we start running into some problems.
Yeah. Where you've lit the match and the match keeps going.
Right. There's plenty of gasoline to go around. Yeah. So if we're eating foods that are already pro-inflammatory, so wheat and grains and saturated or high saturated foods and oils, yeah. And just fried foods, yeah. We're just going to ignite the inflammation system even more. Another big one is using electronics.
Okay.
Mainly because of sleep disturbances, which I'm sure many have seen studies, articles about, not using your phone after a certain point in time at night. The body responds best to natural light like candlelight, moonlight. Those things are easier for the body to accept and use to kind of calm down at night. But staring at your phone while you're laying in bed could cause some of those symptoms to be triggered.
Yeah, so obviously these triggers can be quite vast, and it's very difficult, I should say, to be able to understand which ones are really continuing to pour gasoline on the fire.
Right.
Right on. So that's a tough one to move through. Lastly with this is our service structure, and Lauren has she's moved through a ton of research and learned how to connect that research, the contemporary methods of treating concussions and post-concussion syndrome, with the technology and services that we provide here at Fox Valley Integrated Health and Athletes Evolution. And so we're going to comment a little bit on how we work with somebody that is either in a concussion or needs to be recovered from post-concussion syndrome. So again, our technology and services we're going to be using as according to what the research is demonstrating here in the very contemporary setting of healthcare. And so the first one, obviously we want to dovetail, we want to piggyback on evaluation procedures, because we're always going to need the objective findings and understanding the improvement and how we play in the arena with other providers and making sure that you're getting the right care. The second one is biochemistry. And so when we have these inflammatory processes, these cofactors that are continuing to ignite the process and keep you in this subacute condition, we want to understand from a biochemistry standpoint what other factors might be involved that we need to extinguish. And then the other ones are going to be into the treatment services that we do. So I'm going to let you explain some of the services that you provide these athletes and their the technologies that we work with.
Yeah, so we use mainly our low-level laser therapy, so our cold laser therapy to treat people with concussion or post-concussion syndrome. So after the evaluation process, we kind of pull all those factors together to see which treatment is going to be best for someone. So some people come in, maybe they have gone back to school, but there are certain subjects like math, foreign language, and then sometimes English is a little bit of a problem for some people. They just can't focus. So what we kind of get into is like brain rehab. So we focus in on those areas. Maybe we have someone going through some math flashcards, while we're targeting the brain with the laser, just to kind of help everything fire up together. So that'd be part of our return to learn. As far as return to play, getting back out on the field. Again, it's a different process depending on where we're at. Are we coming from just the concussion side, or are we coming from the post-concussion side? It's going to vary, but going through first a 7-day process, seeing how much physical activity we can handle before going back onto the field. And then we obviously use laser coupled in with some balancing exercises, some lateral movements, up and back movements. While the athlete's performing those, we'll do some laser with them.
Yeah. So as you can see, the platform and the terrain to be able to move through to understand concussion, post-concussion syndrome, what's going on, the treatments that are available, the recovery that's needed for long-term health. It's definitely a maze. There's no A to B. It's an area of gray. So we're here to help, which means that if you need somebody to help do this with you, we're here. Give us a call, come talk to us, set up a consultation, and we'll set up everything that needs to happen in order for you or a loved one or an athlete to make the proper recovery and get back onto the path of good health. So I'm Dr. Josh. This is Lauren. We will talk to you soon.